Hi, I'm Keiko Zoll, social media producer for Fertility Planet, and it is my pleasure to welcome you to today's webinar session, What Your Mama Didn't Tell You About Making Babies. I want to thank all of our attendees for joining us today, and please don't hesitate to share your views and continue the conversation with us in our chat section of this webinar, right below where you are watching right now. You can also continue the conversation on Twitter and Facebook and use the hashtag BabyMakingDays. You can also go to fertilityplanet.com to find more information about our speakers today and to book appointments with any of them, and we'd love to hear from you. And now it is my pleasure to introduce you to Dr. Drayon Birch, also known as Dr. Drai, America's OBGYN, and one of our very own Baby Making Days bloggers, Kelly Baker, who blogs at The Darling Bakers. Dr. Drai and our bloggers that are participating in our Baby Making Days campaign have received review copies of the Clear Blue Fertility Monitor with touchscreen for participating, but all opinions expressed in today's webinar are their own. And so now, without further ado, it is my pleasure to turn this over to Dr. Drai. Welcome, Dr. Drai. Thank you so much for joining us.
Thank you, America, for having me. Thank you, thank you, thank you. Wow.
Sure thing. So I'd love to start by talking about, so our subject today is what your mama didn't tell you about making babies. And I feel like there are a lot of common misconceptions about conception. So I'd love to hear from a medical perspective, what you see in your doctor's office, about some of those common misconceptions that men and women have about trying to get pregnant.
Sex, sex, and more sex. So everyone thinks that you can have sex every day and get preggo, but you really need to have sex at a certain time. So an egg can only live for about 24 to 36 hours, but sperm can live for 5 days. So once again, sperm can live for five days. So you have to have sex at the right time. Some of the ladies are concerned about weight as well. You know, if you're too fluffy, if you're too skinny, likely you're having irregular periods. And if you're having irregular periods, it means that you're not ovulating or releasing an egg. So it's very, very important to be at the ideal weight. Stay away from those fatty foods. Foods that you should eat are oysters. Watermelon as well will increase your libido. So oysters and watermelon are perfect, and walnuts are perfect foods for you. No smoking at all. Smoking can kill sperm and also toxic to eggs. So we don't want you to smoke at all. And moderate use of alcohol. So those are the main misconceptions I hear in the office every day.
Gotcha. Thank you very much. And those are some great tips. I love the one about oysters and watermelons. I mean, I don't know if those exactly go together, but they do sound delicious independently.
Well, Beyonce had it right. Beyonce had it right when she was like Drunk in Love and, watermelon. She knew what she was talking about.
There you go. So we're talking about sex. We're talking about some misconceptions. And, of course, today is St. Patrick's Day. Everybody's a little bit Irish. Happy St. Patrick's Day, all. And we know that luck plays less of a role in getting pregnant than we might think. And so I'm curious, Dr. Drai, what are some solid steps that couples can take to maximize their chances of getting pregnant while trying to conceive?
Well, it's all about when you're ovulating. So that's very, very important. So the ways that you can tell is that, the vagina gets very, very moist. The discharge will look like egg whites. That's a sign that you can be ovulating. You can have pain on one side of the pelvis, and that can be a sign that you're also ovulating. Your temperature, that basal body temperature that all of you girls love to write down every day, it's important to take that before you get out of the bed, though. So that will increase. But the best way is to get like a ovulation predictor kit. That's the safest way, the best way to tell when you're ovulating.
So ovulation predictor kits. Obviously, we're talking a little bit today about the Clear Blue Fertility Monitor with touchscreen. I'd love it if you could talk a little bit more about how specifically this particular fertility monitor can help couples in their trying to conceive efforts.
Well, I like it because it is touchscreen, and in today's world, everyone has a smartphone. I mean, I have two, but everyone has a smartphone, so it's touchscreen. That's very important. It measures two key hormones, which is also significant for this device, and it can tell you up to 6 days you're the most fertile. As I told you before, sperm can live for 5 days in the vagina, but the egg is only going to be alive for 24 to 36 hours, so it's very, very important to get your sex right.
Very important tip.
Lots of it at the right time.
Awesome. Well, thank you very much. I really appreciate that. So Kelly, I'd love to turn it over to you to talk a little bit about your experience. Now, you've been involved with our Baby Making Days campaign for the last month, and we have appreciated all of your wonderful blog and video content, which, folks, if you're not watching or reading, you need to do that. And we'll make sure you have those links to do so after the webinar. But Kelly, I'd love to talk about what your current experience is with trying to conceive and where you're at in the process right now.
Yeah, well, it's been a lot of fun. So we're actually right in the middle of our, well, actually we're in our peak week of our second cycle using the Clear Blue monitor with touchscreen. And I think that the thing that I would say is the most important about the biggest improvement, I guess, versus what we've been doing in the past, which was tracking with a free app, is that we feel a lot more relaxed about the experience. We don't feel like we're missing out on days. We don't feel like we're going to get it wrong because, I mean, it's 99% accurate at predicting, you know, luteinizing hormone and, you know, so and I have actually last month I felt when I ovulated, which I have never done before, so maybe it's just because I've been thinking so much about it, but it was exactly when the monitor predicted that I was going to ovulate. So that makes us feel really confident about that. And we've been planning dates, you know, in according to what the monitor tells us. So it's made it a lot more fun in a way.
Oh, that's great. That's really cool that you're able to take the experience of, you know, here you're getting this definitive data and sign from the monitor, and then you're able to say, you know what, let's kick this up a notch, make it a little fun, plan a date time around it. That's really cool.
And it almost kind of like gamifies the experience. Like I feel like a lot of us from, you know, Generation X, Generation Y, millennials, we kind of like to gamify everything, you know, exercise and work, and so why not gamify having a baby?
Sure, that's great. I actually want to turn it back to Dr. Drai for just a second. I know Kelly had just mentioned that she actually felt when she was ovulating. Dr. Drai, can you talk about that particular phenomenon? Is that something that all women feel, or some
Not all women? Not all women can feel it, but it's called middle smirts. It's when the egg actually pops out of the ovary. So that's what it's called. And you can get a pain on either side. It usually goes from one side to the other every month to month.
So what happens if you feel it from both sides?
Ooh, twins.
I only felt it on one side.
Good to know. Good to know. So Kelly, I'd love to know. You know, you've talked about how you've been able to schedule dates and whatnot. Can you talk a little bit more about how your husband feels about it and how it's impacted his role in your baby making efforts?
Well, I think it's making him even a little bit more involved than he would normally be. He likes to kind of peek in on the monitor and look for smiley faces, or and he'll ask me, he'll say, "Oh, have you tested today?" And I have to explain to him that you don't test every single day, but he likes to check in and kind of just be a part of that whole process. And you know, he's really enjoyed the fact that, you know, we have more days that because it, you know, predicts estrogen, or detects, I should say, estrogen and luteinizing hormones. So we have more days that we are trying, I guess you could say. So that's obviously, he's a man, so that's fun for him.
Exactly. You know what he wants to do, Kelly. You know what he wants to do.
It's fun for both of us, right? Yeah, so we've been planning a lot of dates at home because we do have a toddler, but you know, we try to get outside of our regular routine and you know, maybe make dinner together and eat it by candlelight or something like that. Maybe we'll try making oysters and watermelon tonight. Who knows?
Oh yeah. Perfect. Walnuts as well. Walnuts are great.
Walnuts, yes.
So, Kelly, I know you've got all this data. Your husband likes to peek in, see the smiley face. What's it like actually being able to gather this data? And have you talked to your doctor about it? Have they found it helpful, or do you find it helpful in talking with a healthcare provider about trying to get pregnant?
Well, I haven't seen a healthcare provider yet, but in the past when I've gone to see a healthcare provider, and they say, oh, what was the first date of your last period? And say if I was pregnant, they would say, oh, and when did you have sex last? And I may or may not have that written down on a piece of paper. I may or may not be, keeping a calendar at that point. So right now I know that I would be, the star patient, and I would have
Yes,
all my
I would love
cycles.
you.
Yeah, all my cycles, all my little hearts on the days that we had sex, and so we would know. We would have concrete, and definitive data to give our healthcare provider.
That's great to know, actually, because a lot of girls come into the office and they have like these like calendars, paper calendars that are in
Oh
their
yeah,
purse.
and I would be one of them.
It's like so unorganized. I can't see what's going on. I'm like, I don't know when you ovulate. I can't tell.
Mm-hmm.
I don't know what's going on.
Exactly. Yeah. So that's something, and it's so easy. I keep it in a little bag in my purse or on my bathroom counter. It just goes back and forth, so it's super easy that I can just take it along to a doctor's appointment anytime.
That's really great. And actually, talking a little bit about more of being in the doctor's office, Dr. Drai, I'd love to know, like, what would your ideal trying to conceive patient be like if she could walk into your office and she just gives you this bevy of information, like everything that you need from her? What does she look like? What is she bringing to you?
I want her to be super cool, not stressed out. That's because when they're stressing, when you ladies stress, you stress me out. I mean, it's tough, it's tough making a baby. I know it is, but it will happen. You just have to, it just takes time for it to happen. So super cool, lay back. I kind of lean towards the granola girls who like to get acupuncture for relaxation, going to the spa, having lots of sex with their husband when they need to, based off of an ovulation kit. Those are my ideal patient. No stress.
I don't know if I'd be your ideal patient, I'll be honest.
I can see that. Actually, I can agree. I can agree with you.
Right. So the ideal patient. I'm just thinking, like, I straight up like go into my doctor's office with a binder of questions and goals.
Of course you do.
I'm a very high maintenance patient. I would love to know also, Dr. Drai, what are things that you want your patients to ask of you, like when they're going in? Like, what are the questions that they need to be asking where it's really going to benefit them the most as they're trying to conceive?
I want them to know their signs of ovulation. That's important because they have to really look for that themselves. I want them to get healthy, eat right, lose weight, exercise, stop drinking alcohol, stop smoking, just be healthy and relax. Relaxation. Find a relaxation technique. I think that's one of the most important things. And don't stress your husband out.
So we need to come in there as de-stressed as possible. Let's not stress other people and not stress our doctor. Okay.
Yes. That is like the perfect thing. And know your history. Know your medical history in your family. Know your medical history because you're going to get pregnant, so that can affect your pregnancy. So know your medical history. Know your family history because that's important to make sure that you're going to have a healthy pregnancy. Take your prenatals, vitamins, drink tons of water, hydration, be hydrated, tons of water.
Okay. Kelly, in terms of this whole idea of relaxing and de-stressing, I'm curious if you or your husband have been doing anything outside of the whole baby-making process, if you're doing anything like acupuncture or any of this to kind of keep yourself as de-stressed as possible during the process.
Well, we're not doing acupuncture, although that would be awesome. But yeah, we have been trying to go on walks together, do exercise, light exercise together. Spend time just talking. I think that talking is a great stress reliever. And kind of enjoying each other outside of the whole, TTC, trying to conceive experience, because you can definitely get really caught up in it. You can start to feel really stressed out, which Dr. Drai does not like. And So it can become a chore, and we don't want that to become a chore. Especially when you're older like me, and it takes a little longer. When we were 19, it took no time to have a baby. Now I'm 37, and it takes a few months to get there. So
Sure.
yeah, so it can start to get old, and so I think it's really important to spend baby making time together too.
Sure, that's great.
And the thing is, the less stressed you are, the better your body works. So that's why I'm like, that's the most important thing, like de-stress yourself so your body can work and have fun. Sex is supposed to be fun. It's not a chore. Have fun. Have sex outside, wherever you want to have sex. Just do it at the right time.
Right.
I think my neighbors would have something to say about that.
Thank you, Liv.
Actually, Kelly's point about age actually reminded me of another question, Dr. Dre, that I wanted to ask about. How long what are the recommendations around how long a couple should be trying if things aren't succeeding, if they aren't able to conceive? Like, how long should it be before they need to move on to, going to their OBGYN or even going off to a fertility specialist? Do you have what those recommendations are?
Yeah, so less than age 35, you can try for a year. So a year. Okay, so it's not a month and then come in to see Dr. Dre. I'm not pregnant. Oh my God, what's going on? I'm 34. No, it's a whole year of trying unprotected sex at under 35, and then you can come in to see me for infertility. If you're over 35, 35 to 40, 6 months. Over 40, go to your doctor immediately.
Okay, good to know. Thank you. I think that's pretty much, if there's anything else that Dr. Dre or Kelly, if you kind of want to throw in there, I'd love to turn it over to some questions that we've been getting. We're getting some questions on Twitter, a few through our chat, and we've had a few come in on email. So if you don't mind, I'm going to turn that over there. So first, we have a tweet from Ashley. She said, I thought sperm could live 12 hours. Is that right?
5 days, up to 5 days in the vagina.
Okay. Good to know. All right. So let's see some other questions that we have gotten. So Dr. Dre, you've had a bunch of different tips about couples trying to conceive in terms of things they should be doing, things they should be not doing, eating, not eating. What is your absolute super number one top tip that you would have for women trying to get pregnant?
Don't stress. That is the biggest thing, because I feel like when they come into the office, like the tension, I can just tell something is wrong because they're very tense, their demeanor. Your body isn't going to work that way. You have to be really relaxed. When you relax, you want to have sex, you have orgasms, and then everything will work. So stress is like the number one thing that I tell people not to be. Don't stress out at all. Stress out when your kid is 18, ready to go to college. That's stressful. I'm
already stressed with a 2-year-old, so okay. I've got 16 more years to calm down.
Stress out about that when he draws with a marker on the wall. That's something to stress out about.
So here's so we have another follow-up question to that. So the more that you try not to stress, it can sometimes create more stress. So how do you not be stressed about being stressed?
Yeah, she's like my typical patient right there, yeah. That's one of my patients that just tweeted that question to you. Yeah, so you have to have your techniques, your remedies before you start trying to conceive. So if you like to go to the spa once a week, if you like to get your nails done, if you like massages, you have to have that all lined up. Yeah. I have a couple girls who like dancing. They like to do that Zumba dancing, so they do that. So whatever you like to do to de-stress your body, do it. Whatever you like to do. But have a plan.
Okay.
And then sometimes actually ask your doctor, because acupuncture can be covered on the insurance, certain insurance, so ask your doctor about that.
Awesome. Very good to know. I'm a big fan of acupuncture personally. I love it. It's very de-stressing for me. I need to find more time for it in my life, to be honest. Let's see. Other questions that we have got in. We have a question from email for you, Kelly, asking what it's been like been like for you actually blogging and vlogging about your trying to conceive experience.
It's definitely one of the more vulnerable series that I've done. So I haven't done anything like that before, and I've had a great response from my readers and viewers, which is awesome. But it's also been a lot of fun, and I'll have that to look back on, hopefully when I'm pregnant and I have another little one running around. So that's kind of neat. Or two. Or twins. Yeah, so it's kind of like keeping a journal in a way.
Oh, that's really great. We're so glad to be able to have you a part of this campaign, and we love your posts and everything that you've been sharing about your experience. And I know as somebody, I've blogged about infertility for 4 or 5 years, so I totally understand that coming from a point of vulnerability. And I think it's really important to be able to share those stories, because I think there are a lot of people out there who are trying to conceive, and they're trying to connect with other people who are going through those similar experiences. So I think it's really phenomenal that we're able to have you to step up to the plate to be brave and vulnerable for us, and share your experience. So I think that's really awesome. We have another tweet coming in. It says, Dr. Drai says, have sex Friday, Saturday, and Sunday. How should you space that?
I said to have it Friday, Saturday, Sunday. I want you to have lots of sex. That's what I want you to have. But I want you to have lots of sex at the right time. When you're ovulating, all it takes is that one time when you're ovulating. A couple days before, a couple days after the eggs release, because remember, sperm can stay in the vagina for 5 days. And there's no like position that you can get in to make you get preggo like earlier. I mean, semen and sperm so powerful, they just like swim right where they need to go. So just put it inside the vagina and you're good.
Okay. Is there an advantage to having sex every single day versus every other day? I know I've kind of heard pros and cons for either.
So yeah, I always tell everyone to have sex every day, because likely you're gonna have sex every day anyway, because you see that you're ovulating and you're like, I'm supposed to have sex. So go ahead, have fun.
Okay.
Because you're gonna do it anyway.
That is great advice. Thank you very much. Let's see, what other questions have we got coming in? A couple of questions about the monitor, actually, and this is for both folks. And Dr. Drai, I'll ask you first. As a healthcare professional, what are some of your favorite things about the actual fertility monitor itself?
The data. It stores data, and it's easy to read, and it's touchscreen. I mean, I like I'm a techie kind of, so I like technology, and that's a touchscreen. I just love it. And I love that it monitors 2 hormones, the LH hormone and estrogen. So, love it.
Awesome. And Kelly, I'll turn that same question over to you as somebody who is currently trying to conceive, and you are using this in your own baby making days efforts. What is it that you love about the monitor? What are some of your favorite features about it?
Well, I love the design. First of all, it's really adorable. It looks like a little powder compact, and it's very portable, which is important because you're not always going to be able to predict that you're going to be at home when it's time to test. And also that it stores the data. So anything that I can have in a device that's stored and I don't have to keep in my brain is a definite plus for me, because I have a toddler, so I can get very forgetful at times.
It is cute, but it's bigger than a powder. It's about,
Well, I have one of those big, loose powders. It's like a loose powder. Yeah.
My powder, little thing that I have for my face.
Not like a pressed powder.
It is very compact. I will attest to that. And I personally, I like the color. I think it's cute. It's cool. So that's my own bias towards it. Let's see if we have some other questions coming in. Scrolling through what I have here. Here's one that just came in. How do you, not everybody is a blogger or a vlogger or their own media personality, and so they may not necessarily be like, let me walk into my doctor's office and just be like, hey, I'm trying to have a baby. What, Dr. Drai, how is the best way to actually bring it up with your doctor if it's not, you haven't even necessarily told family or friends that you're trying to conceive, let alone your doctor. So how do you initiate that conversation with your doctor?
Well, a good doctor is going to ask you, when are you going to have a baby? I'm like, come on, let's plan this out. A good
Fair
doctor is going to ask you when you're going to have a baby. But, just if you have the right doctor, you will be comfortable enough to just ask them, him or her, and just say, I'm ready to have a kid. So if you're not comfortable enough to ask those questions and talk about sex and discharge and boobs, like if you're not going to be comfortable talking about that stuff with your doctor, you have to find a new one.
Very good. Interesting. I think sometimes people are hesitant to get a second opinion, but I think there's a lot of value in it, especially if you feel like you don't have that good relationship with your doctor. Like, I'm a very high maintenance patient, so I'm like, I need to make sure that my doctor gets me, I get my doctor, that we're on the same page when I'm literally coming in with a binder full of pages that we both need to get on. So we have another question that just came in. Let's see, Dr. Drai. Oh, what do you tell patients who are tired of telling family and friends that they are trying, and that could they please stop asking?
Don't tell them. It's none of their business. Just like when you get pregnant, don't tell them until you're, in the second trimester. It's no one's business. It's between you and the guy that you're doing it with. So keep it to yourself.
That's good advice. I like that. Another question for Dr. Drai. Do you see partners who are on different pages with each other, and what do you tell them to get back on track together?
Go to counseling first. I mean, I had just today in the office, I have a female who wants to have a baby and her husband that doesn't want to have a baby. And I'm like, this isn't going to work, okay? So you guys need to go to counseling and sort out why this one wants to do it and this one doesn't want to do it. You got to figure it out. You have to be on the same page for your bodies to work and make it happen. Counseling.
Great, awesome. No, that's definitely a good compliment. You want to make sure that yes, you and your partner are on the same page, and that if you're not, then it's good to get intervention to get on that same wavelength. So we have time for one last question that we've gotten from our audience today, and actually this is for you, Kelly. So you have your blog, you're writing about your experience, but have you actually shared your journey and experience with your own friends and family? Are they as much in the loop as your blog readers are?
No.
Oh.
Actually, no, I have not discussed it with family yet at all, outside, of course, of my husband. And I don't believe that most of my family members read my blog. So I would just rather tell them when I am pregnant, because, of course, the moms are going to be super excited to hear that we're even trying. But I don't want to get their hopes up. I'd rather come to them and say, hey, I'm already pregnant. I do have a friend that is kind of like the expert on trying to conceive. So she's the one that I text all of my pictures of pregnancy tests to, and she helps me analyze, microanalyze every little sign and feeling, and so I think everybody needs that one friend. But she's probably about it. Yeah, I'd rather just come to people with a positive test and a sonogram photo and do it that way with a big fun announcement, something like that.
Or sign of a penis or vagina. You're like, oh, it's a boy, it's a girl.
Yeah, something like that.
Right?
Yeah.
Hamburger hot dog sign. That's what it's called. Hamburger sign or hot dog sign.
I've never heard that term before.
That's what we call it. Hamburger hot dog. That's what it looks like.
Well, okay then.
Funny.
That is funny.
Awesome.
But that's true, Kelly. I like that you said that you need to have like a support. Yes, so anyone that's trying to get pregnant, I always say have a group of friends that are your support group and kind of keep, you can tell them, but family members can be very intrusive into marriages and into lives. So I always say the less they know, the better. Until
Awesome.
they start babysitting.
Well, yeah.
That's different.
That is great advice. Thank you both for sharing that. And that actually wraps up our Q&A portion. I know there are some folks out there who may not have had their questions answered, but please feel free to send those on to our way, and we'll be sure to get those over to Dr. Drai and Kelly. And I just want to thank both Dr. Drai and Kelly for spending some time with our audience today and sharing your expertise and experiences with us. This has been a fantastic conversation. It's been hilarious and wonderful just to hear all of the the great advice and stories that both of you have shared. And you can learn more about all of our speakers, sponsors, and book appointments with most of our experts by actually going to fertilityplanet.com. And you'll also be able to watch a video of this webinar if you tuned in late or just came in for the last little bit. This will be live on our website within the next day or so, and you can watch this video as well as videos of all of our webinars on the Fertility Planet website for free. And of course, we want to thank you, our attendees, our audience, for joining us. We hope that you'll share your views and questions and continue the conversation with us in our Baby Making Days group on the Fertility Planet site, and also on Twitter and Facebook with the hashtag Baby Making Days. We would absolutely love to hear from you. And now you'll be able to see how you can follow up with our speakers today. And thank you so much for watching.